Hi, and welcome to Healthy Living. I'm Debbie Lyons here with Kelly Presnell, Director of PR and Marketing here at Hillhead Hospital, and we're going to talk about orthopedics today. I'm excited about this. Share with us.
Dr. Doug Scott, he's one of the orthopedic surgeons on our medical staff. He's fellowship trained in shoulder, upper extremities, and he's going to talk about that and sports injuries as well. There's a lot of active adults, now athletes with the university in our area along with the high schools, and just give some good tips on prevention, wellness, when to see an orthopedic surgeon, and just some general good health and wellness.
That's exciting.
Yeah.
We're going to talk to Dr. Scott in just a moment.
The vision for Hillhead Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here at Hillhead Hospital.
No one likes to wait, especially in any ER waiting room. I mean, when I'm sick or my family has a medical issue, I don't feel like waiting around with a lot of other people. Not to mention they're sick too. Honey. And my family does not wait patiently. You can imagine how uncomfortable and how long it can seem. But then I found out it doesn't have to be that way. I can check in online and wait anywhere I want. What's not to love?
It's the smarter way to ER at Hilton Head Hospital.
We are back here on Healthy Living. We are talking to Dr. Doug Scott. Thank you very much for joining us. It's always a treat to talk with you.
Happy to be here, sure.
And I tell you what, there's a lot to talk about, especially during this time of year. It's sports season, and I think we're all gearing up for all the activities. We were just talking about many of the folks that are here with us today have kids in school.
Sure.
And you do quite a bit. You're the physician for a lot of sports teams.
Absolutely, and it is time of year for all the sports to start up, especially the fall sports for kids going back to college here locally at USCB.
Okay, is that who you do, USCB?
I'm the team physician for USCB and also help out the local high schools here.
How fun is that?
Yeah, it's
Let's
terrific.
talk about a little bit about what that would entail for you. What would the team physician be responsible for?
Really supervising the aspect of all medical care for the student athletes.
Okay.
So that involves working with, probably the most important thing is being in communication and really in constant contact, because you can imagine these are injuries and issues and questions and things that pop up all the time. So probably the most important aspect of being a good team physician is having contact with the student athletes, with the trainers, with the therapists, about making sure the teams and athletes are moving forward.
You know, it's really interesting because I deal with athletes sometimes too, and I find that the things that they ask about are often fascinating. And one is their because they're young, I think, their resilience to recognizing if they are injured or not.
Absolutely.
How do you deal with something like that? You do a physical initially.
Absolutely.
Do kids talk to you about their vulnerable areas, or do you say, look, you know, you're playing soccer and if you get popped in the head or the whatever,
Yeah, absolutely. Probably to answer your question, the most important thing is just having good communication and being a good doctor and really treating everyone individually. So that's where a team physician and a sports physician would treat a professional golfer or a collegiate golfer different than a golfer here playing socially on the weekend.
Okay, all right.
So we really are rather aggressive about trying to get people in tip-top shape as possible to get back on the course or to get back on the field. So it's really a matter of finding an exact diagnosis and which injuries someone might play through or someone that might stop someone for play, because it's all about getting the students back on back on the gridiron.
Yeah.
Sure.
Are you looking at prevention? Again, is there an educational component to this where you're like, okay, guys, you play golf or you do this or you do that. Here's where you need to pay attention.
Absolutely, and probably just as part of any training routine, just having good stretching and strengthening program to stabilize joints and musculature, and just having a good understanding of what is something that someone could play through and what's something when they need to call me and we need to take a better look.
It's really interesting because one of the things that you say that just popped out at me already is stretching.
Sure.
You know, it's interesting when I look at some of the guys that I've worked with, and I'm at 61. I'm touching my toes and asking them to touch their toes, and they're like, "Rrr."
Absolutely.
And so stretching for them sometimes has a connotation that's maybe they don't need to do that. It's kind of I'm going to power through it.
Yeah, it's and again, everyone's a little bit different, but stretch, especially bending forward and touching your toes, really working on the hamstrings. That's a common area that we see tight, and especially when we look at the paraspinal muscles and the low back muscles, that's an area also where stretching would be important. So it's important whether you're 60 and playing golf on the weekend, or swimming every morning, or playing collegiate soccer at the college here. It's important for everyone.
As an orthopedic doc, how do you like to see your general patient population, and I know it's different with every age, divide up their movement, if you will, in order to best maximize their bodies?
That's a good question. Probably everyone's a little bit different, but we would always focus on just overall health and activity, and just being healthy and active. So just having a good cardio balance, just having good nutrition and eating well, and just good common sense of taking care of yourself and being smart about it. Not doing repetitive movements, not doing the same thing over and again, but almost kind of the concept of cross-training, which has obviously become popular, of just keeping a good balance on everyone. That goes for everyone.
There's science behind everything that you talk about when you're talking about the biomechanics, if you will, of the body too. Do we forget about that and tend to fall into the sports fad kinds of thing where?
That's a good question, but really there's always all kinds of new literature and research and products and braces and exercises and tapes coming out, but it's a circle, and it all comes back to just being overall active and healthy and just keeping a good balance.
Do you actually see your athletes, do you go to all the games, or are you called in?
I go to some of the games, but again, I can't go to every game, as you can imagine, especially
because he has two little children to handle.
Right. But I can't go to all the games, and no one could, but just being, again, it's important to be connected and be a part of the community to help our local student athletes, and just being in touch with all the trainers and everyone on the sidelines and on the side of the court.
Well, I think it sounds like a lot of fun.
It's an important part of my practice and my life.
Is there an injury that is very common among young athletes?
There can be, and again, it depends on the sport, as you can imagine.
Yes.
So if you really, different things are going to be common and statistically more common for a different subset of the population. For instance, statistically, when you take a look at, for instance, a soccer player, we worry about concussions, which has been in the news a lot, and people most know it from just as far as television about NFL football, but obviously concussions is something we take a look at, especially in women's soccer. And and a lot of people think of it as NFL or on the professional level, but it's important to really have a good understanding and have good local leaders here and a good treatment plan and algorithms for helping collegiate and high school players and even younger student athletes with things like concussions or knee injuries, such as a meniscus tear or an ACL tear, or especially in a throwing athlete, like for a baseball or softball, we see issues with we see issues with the upper extremity, like elbow pain, or you've heard of Tommy John surgery on the inside of the elbow, or a rotator cuff issue, or the labrum of the shoulder. Those are common things we see in throwing athletes. So everyone's a little bit different, and part of the fun.
Exactly. Are there body types that are more susceptible? Is there a genetic predisposition to some of these injuries? Is it sometimes just a matter of technique? And
that's a good question. We know, though, statistically, that even if you do everything perfectly, that certain subsets of body morphic types are going to be prone to different injuries. Some of the most exciting research recently has been on the predominance of ACL tears or ACL injuries in females. So we're finding that the more flexible a younger woman might be when playing high school basketball or volleyball might make someone prone to having an ACL tear, just for the give and the flexibility and the need that might not be there for a male.
So the more flexible they are, it makes them maybe a bit more vulnerable.
Possibly, and to go back to your point, it really brings about the importance of a good stretching program and a good balance to keep the quadriceps strengthened and a good proprioception activity to keep the knee stable rather than susceptible to injury. We see it more commonly. The prevention side of medicine is particularly and perhaps the most important after someone's already had an injury to prevent a re-injury in the future.
Typically when an athlete or a student athlete goes through an injury, and I know, again, we're talking sort of broadly, you said treatment plan is critical. And is there, like you talked about, kind of an ongoing protocol to prevent that injury again?
Yeah, especially someone that's had an injury, especially someone who's had, for instance, Tommy John surgery, which we even see a lot at the collegiate level.
Now, what is that?
Tommy John specifically, the eponym is for the famous pitcher, but the ulnar collateral ligament, which is one of the main, I don't know if you can see this, but one of the main stabilizers
Here,
of the inside. Sure, one of the ligament basically run on the inside of the elbow. So as you're getting back in almost a cocking and early acceleration phase of throwing, it's really going to stress that ligament and stress that inside of the elbow. So we see a high predominance and issue with breakdown of that tissue for very, very competitive athletes, even at competitive collegiate and professional athletes. So you can imagine that after someone's had an injury to that area, but the reason why we would help someone with that surgery or with treating that issue is because that person isn't just trying to go to the grocery store or do simple things or write. That person's trying to return to throwing. That person's trying to return to pitching. And you know, the good news is that we have a lot of various techniques and treatment modalities and new surgeries, as you might be familiar with the national press, that we are able to help those people get back to a competitive throwing to the point where they're often back to professional pitching.
It's so interesting. We're going to take a break. We're going to come right back and talk to Dr. Scott about some more interesting things orthopedically. One of the things I want to talk about when we come back is heat versus ice.
Sure.
All right, and talk a little bit about shoulders too. So stay with us. We'll be right back here on Healthy Living.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Lowcountry, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Lowcountry, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
We are back and we are talking orthopedic issues, I guess, if you will, with Dr. Douglas Scott. Thank you for joining us. Again, one of the questions I think many of us have, and we touched on it before the break, is the difference in when to use heat and ice.
That's a great question. Probably a question in the office I'm asked almost every day by folks, especially in our community. People are so active in our community trying to get back to tennis and trying to get back to golf. So the reality is those two different modalities, heat and ice, actually work well for most people. Both work well for people as in ice works for some people and heat works for some people for the same issue, and actually a combination can help. Classically, if an area is swollen and inflamed or irritated, cooling the area or some ice can help cool it down.
Okay.
But if often something can be very tight and irritated or stiff, and actually heat to that area can help relax the muscles and the tendons and the soft tissues, and can help relax a joint, especially to make it more flexible. So oddly enough, it's both of those typically work well for different things.
You know, the first segment we talked a lot about kids and the younger population, if you will, but our demographic is generally adults,
Sure.
Young adults through older adults.
Especially looking at orthopedic.
Exactly,
Sure.
exactly. As we age, are there things that do we just wear out? And typically, what would that be? What would that look like? Are there some symptoms? We were talking before. How do I know when to come to see you?
So good question. And classically, when we see, you know, especially again in our community, playing golf and tennis and being active with other sports, especially water sports, we would see, absolutely, we see issues with the upper extremity, the shoulder and elbow are common places to have wear and tear or a little arthritis or bursitis or tendonitis, and especially knee pain, ankle pain, and lower back pain.
Okay.
So classically, with something inflamed without an injury, classically we would think about just common sense anti-inflammatory things to help cool it down, resting the area, some ice or heat like we talked about, an over-the-counter anti-inflammatory like an aspirin or Advil.
Yeah,
Motrin,
I want to talk
helps.
about that. Yes, when we talk about an anti-inflammatory, difference between like a Tylenol, an aspirin, an ibuprofen, and Aleve, and I get that all the time. You know,
Sure.
What do I take?
Sure.
What do I want?
Good
Pain
question.
relief? Do I want
Good question.
inflammation relief?
That's a great question, because people go to the drugstore and say they see 100 different boxes or 100 different names, and there's Motrin and Advil and Aleve and aspirin and Tylenol. And probably the important thing to remember is, for folks watching at home, Tylenol is really different than all those anti-inflammatories. So Tylenol or acetaminophen is really just for pain relief.
Okay.
And all the other ones I talked about are similar in that they're anti-inflammatories. Technically, some of them are different molecules or different doses. So different things work for different people in that regard. But barring some contraindications or some medical interaction, in orthopedics, we would typically ask someone to take that variety of anti-inflammatory measures rather than the Tylenol.
Yeah. Talk to me, if you will, about inflammation. There again, we talked about ice and about heat. Inflammation is this word we throw around. Is it something I see? Is it something I feel? Where does it typically occur?
Great question, and it's something you feel more than anything. So it's really broadcast in the form of pain, swelling, warmth, and irritation. But the most common reason why someone would be irritated or bothered by it would be pain. So if something's not painful but it's just a little warm or swollen, people kind of blow it off and they don't really notice it much.
This too will, right. Oh, it's a sports injury, yippee.
And that's right, and that's not too much to worry about. But when something's painful or bothering him or her, then that's a good reason to take an anti-inflammatory and get it to calm down.
Then coming back full circle to coming to you, at what point, if I've hurt my shoulder, I take an Advil or I take a whatever and I give it a 24 hours.
Sure.
Because, and I want to talk to you about what pain looks like and is and feels like and how to describe it too, so that I know when my discomfort becomes significant enough to come to you.
Sure, great question, and maybe the most important question for people watching today. So it's probably the main thing is to know of a chronic issue or irritation or wear and tear or a way that you're being bothered with, and versus an injury. So if you have a fall while playing tennis, or a twist of the knee, or fall onto an outstretched extremity like that and injure or sprain the wrist, those statistically are probably better reasons to come have an evaluation if something's still bothering you after a day or two, because we want to make sure there's not a tiny little crack or a sprain or a little muscle tear somewhere in the body. So those are probably reasons to see us sooner. But in general, if you're just having some aches and pains and soreness, it would actually, just from being active, it would be reasonable to take a variety of anti-inflammatory measures for a week or two. And the key is, as you can imagine, as long as those things are working, then I would really be reassured. So,
you know, I go to my family physician to kind of get a generalized checkup every year. I go to my gynecologist, all those kinds of things. Is it ever appropriate as you get older to just say, look, I would like to just come kind of establish a baseline. you know, this hurts or this hurts, or, you know, I just kind of want to give you an overview of my boo-boos and aches and pains, and is there anything that I need to pay attention to?
That's a great question, a question we get a lot, and it's probably based on how much a joint or how much a body part's bothering you. We probably don't recommend any sort of specific prevention as opposed to other aspects of medicine and orthopedics. There would really not be a great reason to come just get an x-ray of a neck just for fun, just to make sure nothing's going to happen in the future. We probably wouldn't recommend that. However,
we might find something we don't want to see, right?
Well, that'd be very rare.
Right.
But however, though, if it's important to listen to your body, and it's important to get a gauge of something that's been pestering you or bothering you or repetitive, and especially the key is when the general modalities, the general anti-inflammatory things we talked about, when those aren't working and something's persisting past that, that's typically when we see a patient.
Is there a difference between discomfort that is muscular and one that is what I would call bone?
That's a good question, and often it's not, or it's hard to define, as in people can have the same intensity of pain or quality of pain, as in people say it burns or it stabs or it aches or it feels like a toothache in my knee or something. And those things can happen for different reasons. People can have the same quality and description of pain versus pain coming from a bone spur or a joint or a tendon or an injury. So that's where it's important to have a good evaluation. If something's bothering you that badly, just to have a good clinician evaluate the situation and find out which one of those is causing the pain.
Active women hurt things differently than active men?
That's a good question, and I probably would say everyone's a little bit different. There are statistically things we would see more in women than men, but actually, again, it's just part of being a good clinician and finding what's bothering each individual person. That's true, but generally, statistically, women and men are bothered by the same thing about equally.
Talk to me a little bit about what you really enjoy. I know you like to do your love shoulders. That's sort of a specialty for you.
Well, it's my fellowship. So probably my specialty is helping people with orthopedic injuries, broken bones, fractures, and my passion is with upper extremity and sports-related injuries specifically. So helping people after a sports injury.
Well, that's why you were talking about the ligament.
Exactly, something like that, or a shoulder injury with via sports, or with a knee, like an ACL tear or meniscus tear, something like that. And the exciting thing about doing that is we really have new techniques and new technology. So a lot of times they're very, very minimally invasive procedures when we help people. And essentially, probably the majority of surgery I do is actually done with an arthroscope or a microscope.
Is it really? Okay.
Meaning outpatient surgery where people go home right after the procedure.
Talk to me a little bit about some shoulder injuries or some shoulder things that can occur.
So good question. It probably depends on the person, depends on the athlete. But
how about 60-year-old woman?
And that would be something where we see a lot of wear and tear in the shoulder, like an issue with a rotator cuff or a bone spur, or some wear and tear arthritis where the ball and socket's actually getting worn down.
Okay. What is a bone spur? And then I'd like to know what the bone spur is.
Sure.
And
so the shoulder is basically a ball and socket, but what's unique about the shoulder compared to another ball and socket like the hip is that the socket's actually very shallow. So the hip kind of, I hope people can see this, the socket kind of surrounds the ball like this.
All right.
But the shoulder's different, as in the socket's really like a plate. It's very flat, or it's almost, around here I say it's really like a golf ball sitting on a golf tee. So it kind of looks like a golf tee. But we rely on the rest of the shoulder, the rest of the soft tissues, called the rotator cuff, to really surround and make the rest of the socket. So you probably heard that term, the rotator cuff. So we call it a cuff because it really surrounds the shoulder. So a spur is something that can irritate those soft surroundings to the point where it rubs and it gets inflamed and irritated, and sometimes it can even get worn down.
Oh, so that would you then have to have?
Well, no one ever has to have any. That's a great question. No one has to have any surgery, even though I'm a surgeon.
Right.
Surgery is always a last resort for something like that. So typically, in the vast majority of the time, we help people first through anti-inflammatories, or sometimes a cortisone shot in that area, or sometimes some physical therapy to help it cool down. And for the most part, surgery is the last resort.
Are elbows vulnerable?
They can be, especially around here. You've heard of tennis elbow, probably, and golfer's elbow. So that's the same kind of issue where we're talking about tendinitis. So a tendon getting inflamed. Classically, tennis elbow would be the outside of the elbow, kind of in this area.
What is the tendon? What does the tendon do for that?
Good question. So the when we talk about the forearm specifically, I hate to use it as an anatomy model here, but
I like it.
But under the skin we have the muscles and the tendons that come. The muscles turn into tendons, and the tendons attach to the bone in this area. So if you kind kind of watch yourself here, as you move your fingers, you can actually see, and if you do this at home, you can actually see the muscles and the tendons flexing through here. And this area is a specific driver of wrist extension, meaning that this area of the elbow is recruited and in charge of extending your wrist like this. So you can imagine with a tennis stroke, everything you do is you start out by taking that racket and really doing a lot of wrist extension. So every stroke you take with tennis and a lot of activities involves flexing those muscles. So that's why we call it tennis elbow.
Everybody who's watching this is like, oh no, we're just getting into this. Please don't go, please don't go. But it is time for us to go. Dr. Scott, thank you so much for joining us on Healthy Living. I think, you know, we're all going to be Googling this and finding you so that we can come and get our boo-boos healed.
Happy to help.
All right, thank you so much for joining us. Thank you all for joining us here on Healthy Living. Have a wonderful week.